Hi, my name is Mackenzie Trujillo, and I'm doing this presentation on the Educated Citizen and Meeting Hall presentation on domestic violence that I did earlier this semester. So I chose this topic because my grandpa actually helped found Project Harmony, which is a children's protective service or a domestic violence resource for victims of DV. He advocated for many victims in many areas of domestic violence, and he was actually the first director of the facility. Normally, he did extra work to spread the word of this resource available to victims in the Omaha, Nebraska areas. After being the director of the facility, he worked with the Douglas County Victims Assistance Program up until retirement, and he actually passed away earlier last month. So this just happened to be kind of a special little connection I get with him now. And not only did my grandpa work there, but my mom has worked there since I was a toddler. She has worked in many areas of the office, and I also volunteered there in high school. I normally volunteered and helped out in the file room, and the file room was just organizing files, which were cases of DV. And I remember thinking that there is a crazy amount of files in this room, and I never realized how prevalent domestic violence was up until that point. So the first of my educated citizens I'm going to talk about is my effective communicator my first year of nursing school. It was first year, second semester, and so we started clinicals. I personally had experience being a certified nursing assistant or CNA in the hospital setting. I was a CNA on the step-down ICU unit at Methodist Hospital, so I wasn't intimidated by too much because I had been caring for some pretty critical patients. But my clinical partner had no experience in the hospital setting, and it just so happened that the patient we were assigned that day had had an accident in her chair, and the nurse had asked if we could help clean her up. My partner actually kind of refused to help. She just thought it was gross and it wasn't really a nurse's job, but I communicated with her that if CNAs aren't available, then it is a nurse's job to help out. Obviously, the patient was pretty embarrassed and she kept apologizing about the situation. And you could tell that my partner looked just kind of grossed out and annoyed, which made the situation a little bit worse. But throughout, I communicated effectively with both of them on how to make both of them comfortable and get her cleaned up and do it safely. And so in the end, it all worked out fine. But this made me realize that you need to have really strong communication skills between nurses and patients, or hospital staff and patients. You need to have clear, non-judgmental questions and assessments for your patients, especially regarding domestic violence, because you don't want to think that you're implying something with the questions that you're asking them. You need to properly assess the patient and their situation. Don't make assumptions by what you see. And you also need to provide appropriate resources for them, and use of appropriate oral and nonverbal skills to help further assess the situation. Nonverbal communication skills are especially important in domestic violence situations, as if the partner has their abuser, or if the victim has their abuser in the room with them, you need to know how to nonverbally offer help to the victim. Is this your abuser? What can I do to help you? Who do I need to call? Things like that. You need to know how to use nonverbal skills to keep everyone safe. So my second effective communicator came from my fourth year of school. A patient was brought in to the emergency department at Children's Hospital Medical Center, where I was also a CNA. He was brought in with supraventricular tachycardia, or SVT, and basically this is a heart rate above 200, so it's a pretty emergent situation. Once he was brought into the room, it was just a mess of hospital staff trying to get this patient stabilized. My primary role in this scenario was connecting the patient to the EKG machine, which I did. The nurses started their IV. The doctors tried to manually cardiovert the patient, so there's certain ways without medications that we can lower the patient's heart rate, which is cardioversion, which they were not successful with, so the doctors ordered medications to be pushed to help bring down the heart rate. And the monitor in the room showed that his heart rate was going down, that he was stabilized. But the monitor on the EKG, which really only I could view from my position in the room, it showed that his heart rate was actually going back up. So I assessed the situation real quick, made sure that there wasn't, one of the machines wasn't lagging or something or being slow. And I finally spoke up and notified the doctors that the EKG machine was showing a higher heart rate. After the doctors assessed the EKG machine, more meds were pushed, and this patient was finally cardioverted and stabilized. So I reflected on this and I realized that to be an effective communicator, you need to, or if you see something, you need to say something. You need to speak up when you just have that gut feeling in a patient situation, especially involving domestic violence. If there's reoccurring or patients that come in for reoccurring injuries, maybe there's something behind these injuries that they're not telling you. And the stories that they tell you of how they got the injuries aren't actually how they got them. According to the National Coalition Against Domestic Violence, domestic victimization is correlated with a higher rate of depression and suicidal behavior. This just goes to show that deeper investigation and communication with patient and the healthcare team needs to be done to make sure that there isn't something hiding behind medical diagnosis. My reflective individual came from year 2. It was the first semester with babies, children. It was labor and delivery and mother-baby semester. So very different than previous semesters taking care of adults. I had a very difficult time transferring my knowledge from older adults to pregnant women and newborns, and I became very frustrated with my critical thinking skills. They had worked prior in other clinicals, and I was not being as successful, and that was reflecting on my grades and care plans. And so I began distancing myself from the patients due to my frustration of just not being as successful in clinicals. And finally, I acknowledged my personal responsibility to practice better communication skills and ask questions when I needed help. I also did further reflection on personal thoughts and feelings about the situation. I wanted to make sure that I understood myself before I tried helping others. And I also reflected that further assessments from the norm should be made in certain situations, especially domestic violence. According to Smith and Siegel, people who are being physically abused may have frequent injuries with the excuse of accidents, frequently miss work, school, or social occasions without explanation, and dress in clothing designed to hide bruises or scars. And again, this is just evidence that further assessments from the norm that should be made in domestic violence situations. My second reflective individual came from year 3. I was a new CNA in the emergency department at Children's, and a code 99 was called through the squad box. Code 99 means CPR in progress, compressions in progress, and the squad box is just a communication device between ambulances and hospitals. So hospitals know when the ambulances are bringing a patient in. So this was my first time in a pretty serious code as a newer CNA at the hospital, as well as my first time doing compressions. And right after this patient was stabilized and transferred to the PICU, another patient came in, and it was a pretty critical patient. This situation made me reflect on applying and analyzing perspectives of holism during a code. During the first code that we stabilized, I reflected on not only did we provide medical stabilization, but we also provided emotional support and care of the parents in the situation. It was very difficult. And I also reflected on the need of self-care for hospital staff in certain situations. I think every hospital staff person could say that they have that patient or situation that sticks with them. According to Bexy, almost 96% of nurses report experiencing at least one symptom of PTSD, and nearly 21% meet the criteria for clinical diagnosis of PTSD. So I think that this further just states that you need to care for yourself before caring for others, especially in domestic violence situations. If you have a similar history, you don't want to project your life and experiences onto someone else and not be able to competently care for these patients. My change agent came from year 2. It was the postpartum half of the semester. My instructor, unfortunately, was not very involved in the first half of that semester in clinical, and there wasn't much to do because most of the mothers just wanted to be with their newborns. My clinical group became very frustrated with everything that was going on and gave a poor midterm review on my clinical instructor. We didn't know at the time, but our clinical instructor actually read these reviews, and she decided to speak with each of us individually regarding our concerns and complaints of clinical. And she apologized, and she told us how she was going to improve clinical from then on. And after midterms, clinical days did improve. So I learned that speaking up and voicing concerns can be or is beneficial for both groups involved in the situation. Being politely blunt is better than avoiding the situation, no matter how uncomfortable it is. It takes that appropriate initiative and that step to effect change. I think this also kind of relates to see something, say something, especially regarding domestic violence. If you see something, you have to say something to make a change. You also need to have the thorough assessment of the situation and asking appropriate questions before you make assumptions. And with this, honesty is the best policy. You want to be honest with the domestic violence victims about the process of what's going on, how you can help, who's going to be involved, etc. My last change agent came from year 4. I was working night shift on the rehab unit at Methodist Hospital, and I had heard a beeping coming from a patient's room. And so when I was approaching the room, they had actually pressed their call light. I went into the room, and the monitor had accidentally come unplugged, and the battery was dying, so that's why it was beeping. So I was trying to plug it in to stop the beeping, and the patient had said something, but I couldn't hear him due to the noise. And I plugged it back in, the beeping stopped, and the patient was frustrated because I wasn't listening to him. I was being rude. I don't know how to care for patients. He just kept berating me. Do you know how to do your job? How long have you been a CNA? Are you new here? And it was very early in the morning for this, and so I had to calmly collect myself. I stood up for myself. I did apologize, but I made sure to explain the situation from my standpoint and just explain to the patient that he cannot talk to staff like that, even when he is really frustrated. And that if roles were reversed, if he would have appreciated me talking to him like that. And I think this was a really important learning lesson for me because I realized I created a voice for other CNAs and hospital staff regarding how staff should be treated. And this is kind of like advocating for patients in domestic violence. It's super important to first analyze the situation before deciding to voice concerns to help initiate a change. You don't want to assume something or, notify someone that something's going on without further analyzing and making further assessment about the situation. And there is a need for creating a voice for domestic violence victims to initiate a change, and there's a need to know how to speak up in domestic violence situations that occur in the hospital setting. This is especially important as a change agent because you need to make sure you know how to communicate with everyone involved in the situation, especially the abusers if they're present. You need to know how to keep everyone safe. In conclusion, I never really realized how many of my educated citizens would apply to domestic violence. I just assumed that they were all geared to my original, learning. But I think this was a really good learning experience to know that I can apply all of my experiences to be a nurse someday, and I have the skills needed to be an educated citizen and advocate and competently care for patients that I will have in the future. And these are just my references. Thank you for listening.